I chose the Greensboro site for my application phase because I really wanted to be in a community setting. I wanted to be exposed to bread and butter cases, and I wanted to be exposed to what real world medicine is like.
You really get to learn a great deal about pretty much every subspecialty. There are a few that they don't have here, but all the ones you can possibly think of, you will probably have a chance to rotate with.
In every setting I've been to, everyone's been incredibly kind and kind of allowing me to take ownership of my own learning, but also supporting me in the ways. They're always very receptive to what specific things I wish to learn about, and they check in and make sure that I'm keeping on track with not just my clinical duties, but also getting ready for the exams, and then also just taking care of myself.
There's a variety of different patients, very diverse in race and language and gender. And so I feel like I'm getting experience with people from all over the world. I don't feel like there's a specific area that I'm missing out on. If there's a specialty that, say dermatology, that I'm interested in, I've had opportunities to see that. I've had opportunities to see cardiology. And so overall, I feel like it's exceeded my expectations.
The instruction and the quality of instruction and the ratio of faculty to staff is incredibly tight. And what that allows for is if you are showing interest in bringing your best to every rotation, which all of our medical students like to do, you are going to get an immense amount of knowledge out of these rotations. You're going to get a lot of good mentoring on top of that because you're working with these people for an extended period of time. Our new curriculum has 8-week blocks, and you are working oftentimes with the same attendings for those entire 8 weeks.
If an MS3 came to me and asked me why I should choose the Greensboro branch campus, I would tell them because you're going to be educated by real-life community compassionate physicians, and you are going to get great up-and-close clinical training.
A lot of the doctors here are trained at UNC, they're trained at other really fine institutions. They bring that training with them and give it directly to you. So the one thing that I'd love to add is don't overlook Greensboro just because you're unfamiliar with the town. It is a smaller town, but it's not that small. You have a good diverse population here. There are a lot of things to do, but most importantly, in terms of your educational experience, there are fewer places than I can imagine would be a good place to train than it is here.